Hi, my name is Kevin Burns. I'm an interventional radiologist here at the Minimally Invasive Medical Group. If you've been suffering from hemorrhoids, whether that's having bleeding, the bowel movements, pain, discomfort, we have a new innovative solution that's called hemorrhoid artery embolization. What an embolization is a procedure to block off blood flow to a certain organ or body part. In the setting of hemorrhoids, we can get into the hemorrhoidal arteries and put small plugs to slow down the blood flow to the hemorrhoids so that over time they shrivel up. This allows us to treat the hemorrhoids while avoiding more invasive procedures like surgery. With hemorrhoid artery embolization, a small catheter is placed into an artery, generally either in your wrist or in your hip, and we use X-ray to go inside your body, find the arteries to the hemorrhoids, and block them off. This means that there's no wounds in the rectum, which means you don't have any special dietary precautions afterwards. There's no wounds to care for, and pain after this procedure is generally very mild to none. This procedure is quite effective. In studies, it's shown to help about 80 to 90% of patients who are suffering with symptomatic hemorrhoids. That means that patients are having constant bleeding, they're having constant pain. So as a patient, if you're suffering from hemorrhoids, especially if they're bleeding, we have a new innovative procedure called hemorrhoid artery embolization, which can block off the blood supply to the hemorrhoids. We do this all internally through a small catheter that is placed into an artery. We use X-ray guidance to guide a small catheter into the artery, supplying the blood to the hemorrhoid, and we put a small little plug to slow the blood supply internally. This means that nothing goes in the rectum. There are no incisions or wounds that you have to recover from, which also means that you have minimal downtime. You don't have to follow any specific special diets, and you can get back to your normal activities very quickly. Patients generally see results in about 4 to 6 weeks after this procedure. Procedure takes about an hour. You generally recover for about an hour, and then you go home. We do this procedure under sedation, which means you don't need general anesthesia for this procedure. It can be done with you more awake if that's something you prefer as well. Hemorrhoid artery embolization has been studied to show that it's basically as effective as surgery for certain candidates. And if you have any questions about whether or not you're a candidate for this procedure, feel free to reach out to our office to schedule a consultation.